Hello all, and welcome to Qserve Podcast on the countdown to the MDR deadline. My name is Gert Bos, I am CSO of Qserve, and I will be your host. The original podcast series contained 5 episodes, where we will guide you towards the implementation of the MDR. But as so many of you like the podcast, we will continue to make more regular and special episodes. So thank you for continuing to follow our podcast channels called Qserve Talks, and get ready for all the insights from our interdisciplinary group of experts. In our last episode, together with Sabine Hoekstra van den Bos, we discussed several aspects of the availability of notified bodies in regard to the MDR. Today, we will address the topic of biocompatibility and toxicity, one of the critical changes in the MDR technical requirements. And joining for that is Bianca Lutters, Qserve's regulatory affairs expert. Bianca has more than 15 years experience in the medical device field, 10 of which have been spent at 2 major notified bodies, DEKRA and BSI. In her time working for notified bodies, Bianca assessed many design dossiers and technical files. In the last 5 years, Bianca spent as Director of Regulatory and Quality in a startup company with high-risk biodegradable cardiovascular products. Welcome, Bianca.
Thank you, Gert. Happy to join this podcast.
So every episode, I would like to kick off with a general question. And this time I'd like to ask you, Bianca, what your favorite medical device is and why.
I've been thinking about this question, and it's a difficult one because it depends on what I'm looking at a medical device. What is my favorite device? There are devices that are from a design perspective very challenging to design, but there are also devices which from a use perspective are really challenging to look at. And of course, there are devices that are less challenging, but very important for many people in the world that will hopefully feel better after being helped with a medical device. So not a specific type of product, but when I look at the work I do as a consultant, I can see in every product something that I really like.
That's a perfect story. So you have the perfect job then. Every day new chances of discovering new medical devices, innovative devices, and so on.
Yes.
Great. So let's go to our topic and start focusing on biocompatibility as a starter. What hit me when I first read through the final text of the MDR and then the ongoing changes to the biocompatibility standard is that basically the core guidance that was formed by the famous table in part 1 of the series of standards, 10993, it displays what tests to perform for what type of product. Has always been our reference point in, well, that is the expectation. And it has now been pushed down in the chain of evidence to merely a concept of an example. Like everyone has to just start finding their own rules. And I know that in the past companies use some justification of why not to perform certain tests identified in the table. And provided in other ways. But this appears to be a very drastic change, in effect similar to the process of challenging the 14971 a decade ago, which led to the well-known 7 deviations that are still there to account for the difference between general wording in the law, specific expectations in the standard. What's your view on this and how have companies you've seen so far reacted?
Let's start with the how you should look at the standard. It's indeed less focus on the list with test and becoming more risk-based. But in the end, all relevant endpoints need to be addressed with a focus on the final device. And that's very important because that includes all manufacturing steps, including stabilization, packaging. And in many cases, you might have data on the raw material, but not on the final process material and not even on the actual final device. So in part of the cases, you can definitely use justifications, but in most of the cases, this will not be sufficient to support that you have sufficient data on your final device as it's used in the patient. So that means that you still will need to do testing to address the relevant endpoints. With a focus starting first on in vitro, and if you know that those tests are okay, then continue with in vivo, which makes it, from an animal welfare perspective, a good way of looking at your biocompatibility testing. When you start to work with biocompatibility and testing for your device, make sure you create a plan. Which evidence do I have? Which evidence is still lacking? And which gaps do need to be addressed by testing? The newer your device, the more novel your device, the larger the changes. If you are making changes, the more testing you will be required to do. Then you nicely perform your test and you report your test data. And in that way, closing the risk assessment at that moment in time for that specific device. There is also one other aspect that is more clear in the new series of biocompatibility standards, and that's the focus on material characterization. And what we have seen at Qserve is that is a very difficult part, because in many cases you will find unexpected leachables. So when you are going to do a material characterization, make sure you focus on which solvents do I need to use? Why am I using those solvents? Are those the most appropriate solvents for my device? And then in the end, look back at which leachables have I found, and is that all acceptable? What we have seen as reactions from clients to the standard, some clients keep just testing all the tests that are listed by the standard. Some clients, as we have also already seen in the past, just justify that nothing is required. But we also see that there is more and more focus from the notified bodies on biocompatibility. And in many cases, more detailed review questions are seen. And that means that what we at this moment mainly see is helping clients to get them at the level they need to be, at the helping them to get the justifications in place that they need to have to support that their device is safe. Please keep in mind that the 2018 version only just has been harmonized under the MDD, but especially for MDR submission, it's really, we would say, a requirement to comply with that, because it's really considered state of the art. There was one thing to be aware of. The MDR has a general safety and performance requirement on hazardous substances. This is not as such clearly explained as a way of thinking in the biocompatibility series of standards. But if you follow the standard, in many cases, it will help you to further justify, if there are hazardous substances present in your device, that they are acceptable at the level you will find them in your device. So in summary, it might seem easier to waive tests, but with the focus on the final device, including all the manufacturing steps of the device, in practice, it's not that different from a testing perspective.
So just prod on and make sure you get everything right, and don't take the shortcut, basically. I suggest we move into a more specific part, recently published part 23. It introduced in vitro irritation as alternative recognized method. What is your perception on this change, and is there already some indication that notified bodies will be accepting this new standard under the MDR?
It's quite a good change, because it means that there is now a validated test method for an in vitro test for irritation. So it is a good alternative for an animal test. it uses reconstructed human epidermis, and you measure cell viability. So it's not that different from an outcome perspective, what you will see as a simple cytotoxicity test, but the cells you are using is now tissue. It's sufficient if this test shows, according to the standard, that your product is non-irritant when you test it with both a polar and a non-polar extract. It's also not needed to redo this test at the moment you have good irritation data from an in vivo test. The acceptance at this moment is not very clear. I've been listening to a webinar from a test house, and there they indicated that at least part of the notified bodies would accept it, but I haven't seen any evidence in practice. So, however, the current version of the standard for irritation, so ISO 10993-10, is still the harmonized version of the standard under the MDD. There is now a new alternative, and we will learn more on the actual acceptance based on the first reviews of biological evaluations that include this test by notified bodies, but also by the FDA.
So in that sense, manufacturers can take their chance, but it's good to also look back at what we've been doing in the past and make sure that also, well, you're in line with the thinking that has been predominant in the past. You mentioned earlier some of the GSPRs, the 10.3, 10.4, very specific details. And so let's focus on that, on CMR and endocrine disruptors. Perhaps you can give us some best practices on how to get that documented well in the technical documentation. But also the intention is slowly, in my view, moving to 10.1 on the general ingredients and their toxicity, on disclosing ingredients on the label and other documents. On such elements, what is the best practice you see at this stage?
If I look at my experience with manufacturers, I can be very short. Manufacturers are struggling. It's a new requirement, and not everyone fully understands how big the requirement is. Because what you really need to do is check all your ingredients, components for CMR and endocrine disrupting substances. So that's quite a lot of work. This might be supported by leachable testing. The SCHEER committee has a very nice guideline on how to do a biological risk assessment in case you have one of those substances present in your device. And there was also guidance from MedTech Europe. Basically, what you need to do is put on the label at the moment you have more than 0.1% of one of those substances in your device. And the MedTech Europe guidance very clearly explains how you can best document this, and even how to put this in the instructions for use and how to put this on the label. But there's also this guidance also includes how to put the toxic substances and general ingredients on the label and on the the instructions for use. So it's really, if I would need to name a best practice, if you are able to use the MedTech Europe guidance. And in summary, I would say that this is a really time-consuming exercise, as you need to obtain information on all the ingredients and raw materials that are part of your device from your suppliers. So I would recommend to really take sufficient time to do this.
So in line with manufacturers starting to complain early on, we've just done this for the RoHS and so on and so on, now we have to do it again. Well, the question is different and the answers will be different, because basically the requirement is not the same as the RoHS that continues to be there. If we move on and look at, you've said this is a developing field, and we're awaiting some of the reviews from notified bodies, and obviously only with 1% of all certificates to be issued already having been issued, it's very early in the days to know what notified bodies are exactly looking for, what deficiencies are. But if we summarize the trends, and in that summary look at what you have seen so far from notified bodies, from their assessment, deficiencies, public discussion at conferences, perhaps white papers, and so on and so on, what would be the core elements to take into consideration at minimum in prepping for the MDR?
Yes, and I would really focus on the MDR in this case, and especially legacy devices, because what you see with legacy devices is that in many cases, there have been a number of changes to the device over the years, which all have been individually addressed by a limited set of biocompatibility data. So what you see for many manufacturers is that they have kind of patchwork biological evaluation file at this moment in time. So that's also really where we see manufacturers struggling. And that's because the core elements of what a notified body is looking at for MDR certification is really full compliance to all requirements with biological safety. So it's basically a completely new review of your biological evaluation report and plan. So it means that you need to be state of the art for the standards. So use the 2018 version of the -1 standard, but also the 2020 version of the -18 standard if you are able to. Make sure you cover chemical characterization. Make sure you look back at how much patchwork do I have in my file, and can I nicely bring it together, or might it be easier to redo some testing, especially if you have really old tests like from the 1990s that support part of your biological safety evaluation. And of course, there is a lot of focus on CMR and endocrine disrupting substances. So it's not that there are that many new requirements besides GSPR 10, but the challenge is to determine appropriately if you need additional test data, and if yes, which tests need to be repeated to have a very nice, presentable biological evaluation report.
So excellent advice there, Bianca. Thank you for that. And I guess it's also then logical what some manufacturers have started to do is send one dossier into the notified body early on, so that you get familiar with how they rate your thinking and your processes behind the scene. Because then you still have time to adjust if you are at a different track as the notified body. Unfortunately, we have come to an end of this episode. I hope, Bianca, you had some fun.
Of course. Thank you, Gert.
And I hope that you listeners at home have gained some great insight from listening to Bianca. For now, I'd like to wish you all a lovely week and hope to talk to you in one of our next special episodes. So keep an eye out on our website and social media, and I will see you soon.